legislature committee. Do you want to fix that first?
I think that's the drilling outside, actually.
No, Houston, we have a problem.
Wait for the blast.
Waiting 2 years to use it. Okay. Suggested that you try and use some of the extra money that you'll be getting from the healthcare accord whenever you negotiate it for long-term care. Is it your understanding that that would even be possible?
Yeah, I think so. I mean, look, the priorities of the federal government, we share those priorities, and certainly making sure that our seniors in the long-term care system, those in the long-term care system, have a high standard of care. That's a priority of ours. That's a priority of the federal government. So, what I would say to Nova Scotians is we're making significant investments in long-term care, and we will continue to do so. But I would also say those investments that are being made are they're starting to pay off. The program for books and tuition for up to 2,000 CCA students. I think we just registered. That's over 2 years, and I think we just registered the 1,000th person for the first year. So that's fully subscribed. Imagine 1,000 more CCAs entering the long-term care system. That'll have a significant impact. We also, of course, did the increase the remuneration for CCAs, which brought a lot of attention to the opportunity that career holds for caring for Nova Scotians. That's a good thing. It's retained people in the sector. It's attracting people to the sector. So, the investments that we're making in opening up new beds, the commitment to 4.1 hours of care. So I think if one of the things that I think is really important for Nova Scotians to know, and certainly something that the government is proud of, is that this time last year there was I think over 500 beds in the system open. And yesterday I got a number last night. It was 2. So look, the focus on long-term care it's unwavering for sure. We'll continue to invest in long-term care, but we've moved the needle a significant distance, and we will continue to focus on moving that needle. So we'll make investments. We'll partner with the federal government on those investments, but Nova Scotians can rest assured that the focus is there and the investments are there.
Removing that needle has required a lot of money to be spent on travel nurses, and it's money you had to spend because you had to get those bed staffed. But do you have any concern that even as you're rolling out all of these programs to try to get more people into the system, that you will not be able to compete with the packages that travel nurses can receive, which will ultimately keep us stuck with having to use travel nurses way further down the road than you'd maybe like?
There's been a need for travel nurses because of the lack of focus on appropriate human resource plans across the healthcare spectrum. So the need was there. So we had to take steps to fill the need. But when you think about the investments and the initiatives in the human resource aspects of the healthcare system, new seats at the nursing schools, offering jobs to every graduating nurse, all of these things are important aspects, are important parts of the long-term solution. But it's been difficult in the profession for nurses that can't take vacation, can't get a break. So we know all those things. Nova Scotians know all those things. So we're taking steps to support those working in the profession. Expansion of scope is all these things. All the initiatives we've taken in healthcare are all driven towards one thing, and that's to make sure Nova Scotians can access care, but to look after the mental health of our healthcare professionals too. So the travel nurses have been needed. For sure, but we think that the initiatives that we're taking will reduce the need for travel nurses going forward, and we also think that if that's a career decision, some people will continue to make. Others will want a full-time job with all the benefits of a full-time job and consistency of a community. So I'm optimistic that we can turn this around and on the human resource side of things, and I believe the need for travel nurses will go down dramatically.
Do you worry that even you're in negotiations with the nurses now, but do you worry that even if you can come up with the best offer that you can possibly come up with, that it may not be enough to close that gap between what you're offering and what travel nurses get paid?
Anyone who is whose single motivation is the highest hourly rate or the highest salary, we're never going to be the highest paying jurisdiction. That's just the reality. And anyone who's completely 100% driven by compensation will find lots of areas in the world, not even in Canada, but in lots of areas in the world that can probably pay more. But actually, we can offer a lot more than compensation. We'll offer a competitive compensation package, but we're really focused on making sure that they're properly supported, properly staffed, and have the resources that they need. And don't forget the compensation package, pension benefits, all those types of things. Those are important to a lot of people too. So there's a lot of people that have a strong attachment to the province. They want to be respected by their employer and fairly compensated, and I think that those are the people that we can really attract to our system.
Mayor, the Newfoundland set up its own provincially run travel nurse agency. Janet Hazelton has suggested that might be something Nova Scotia might want to look at. Is that in the cards? Is that on the table?
I don't know. So like there'll be certain people in any profession that like a variety, want to move around, want different locations. There'll be others that like the consistency of the same, knowing their patients, knowing their colleagues. So look, our objective is to have sufficient full-time numbers in consistent working environment. That's our anything else that kind of is an interim measure to get us through the crisis. I'm open to every single interim measure to get us through. Travel nurses have been kind of hopefully an interim measure. I'm open to all interim measures to get us through the crisis. But our objective is a properly staffed human resource system across the healthcare system.
Premier, how did Cresco get involved with the province in talks about a transitional care facility?
So look, I just spoke about my number one focus is on access to care, patient care, health care. Number one focus, really two focuses I have as Premier: fixing health care and paying for the fixing of health care. That's really my entire being right now. So we know that there are issues in the healthcare system, some of the staffing ones we've been talking about, also issues in the system with beds. And one of the things, for example, that we hear a lot from surgeries and stuff is that they can't do a surgery because there's no recovery bed, and all the issues we know that are in the system. So we're focused on adding capacity to the system, adding beds to the system because we're focused on patients. That's our focus. So looking for ways to add beds is something that we've been very focused on. This was an opportunity and is a good opportunity to add. It's part of the solution in adding beds. So we did a scan as to what's possible. What's the art of the possibility in terms of adding beds to the system? So we turn over every stone in fixing healthcare. We really do, and this was a good opportunity to add beds to the system, to add capacity. It was identified as a good opportunity, so that's the opportunity we pursued.
So did the province approach Cresco, or did Cresco approach the province?
I think there was a scan of what's available, what could quickly or relatively quickly be made appropriate for adding beds. This was a property that came up, and so I think that's how the interest in it was, and I think at the time Cresco was in talks, and the province partnered with them.
Right. So Cresco didn't own the property at the time you identified it.
The department would know the full specifics of it. I was only interested in adding beds to the system.
Did you ever speak with any officials from Cresco about this property?
No.
Do you have any concerns about the report that flags the fact that this building, as designed, is not fully accessible and the hallways may not be wide enough to accommodate patients who ultimately will go to long-term care, which, as it was announced back in December, that's part of the point of these, is to get the bed blockers out of inpatient beds, right?
Yeah. And there's lots of obviously individual situations on how we can free up beds. So we know, I think in the spring there'll be a kind of a fulsome plan as to how we can make that fit the exact needs that we have. But the needs we have are significant. This is part of the solution. There'll be other parts to the solution, but certainly we know, I guess, when you buy a building that's under construction, it's under construction, and that construction will continue, and we'll make sure that it's suitable for what we need, which is beds, which is needed for patient care.
Premier, with the new all-time high for primary care waitlist, what would you say to Nova Scotians who see this and feel hopeless?
There's lots of, that's a number that concerns me for sure. I spend a lot of time thinking about those Nova Scotians. But what I would say to them is there's lots of reason for hope. There are lots of things happening in the healthcare system. And also the people on that list, being on that list doesn't mean you can't access care. We're opening up other avenues to care, mobile clinics, virtual care. So we'll continue to focus on that. We want people to have a consistent long-term health home that they can turn to. But as we work through this crisis, it's really a national crisis in so many ways, we want to open up avenues for them to access care. So we know a lot more about that list than we've known in the past. We know that there's a significant percentage of people on that list have accessed care in one way or another in the last year. So what I would say to them is that their government is very focused on fixing healthcare. I'm personally concerned about those situations where there's difficulty accessing care. We'll continue to open up avenues so that they can get the care they need.
Quite a large number of people on that list are people who have recently moved here. Does it give you pause with your government strategy to try to drive the population of the province up at a time when we don't really have the services to accommodate new people who are moving here? Is there a bit of an incongruity that goes on with those two messages?
No. It's the what you're referring to is the challenges of growth. And there are challenges of growth. And we know that there's challenges in housing. We know that there's challenges in healthcare. Those are challenges of growth. This province has spent a significant amount of time experiences the challenges on the other side of the coin. And I would say that as Premier, I welcome the challenges of growth.
What are your thoughts on the departure of RCMP Commissioner Brenda Lucki?
I look forward to the federal government's appointment of a new commissioner. I hope that new commissioner listens carefully and is responsive to the outcome of the inquiry here. That incredible tragedy we suffered in this province. That tragedy changed our province forever, and I'm hopeful that it leads to changes in policing, in law enforcement, and I look forward to the new commissioner and hope that they're of the same mind.
We have time for just one more question.
she should have stayed through?
Are you in any way concerned that her retirement will absolve her of any responsibility for what happened, and there won't be the kind of accountability that you would like?
I don't have that concern. No, I mean the inquiry is we look forward to the results of the inquiry, and then the recommendations of the inquiry, and whatever follows from the inquiry. I mean, I'll certainly be pushing to make sure that those recommendations are followed and whatever action is necessary is taken for sure.
Think she should have stayed through, see it through?
I don't have an opinion on it. She made a personal decision. The federal government will appoint a new commissioner, and I expect that new commissioner is focused on the implementation of the recommendation of the inquiry as well.
And that's all the time we have. Thank you.
Okay, thanks everyone.